I think it's just for aesthetics, you know?
Wait, what? You think drugs are coated just to beautify them? Okay, you must have seen different forms of oral drugs. Some look like little shiny candies, smooth and colored. Others plain, chalky white. Some others have a thin, transparent film over them. And some are coated in what looks like pure sugar. Most people assume it's just for aesthetics, maybe to make the pill look more professional. But every single one of those coatings was put there for a precise pharmacological reason. Today on PharmaCore Academy, we are going deep on one of the most underappreciated topics in pharmaceutical science, tablet coating. What it is, why it is done, the different types, and the real advantages and disadvantages that every pharmacy student needs to know. Let's get into it, core scholars. So, what exactly is tablet coating? Simply put, it is the process of applying a thin outer layer, called a coat, over a compressed tablet or capsule. Think of the tablet as a payload, the active drug, and the coating as the delivery vehicle. The coat decides when the drug is released, where it's released, and how fast it gets into your bloodstream. That coat is made from various materials, depending on what job it needs to do. It could be a polymer, a sugar solution, a wax, or a specialized pH-sensitive chemical. Now, coating is broadly divided into three main categories: sugar coating, film coating, and enteric coating. Let's break each one down. Sugar coating is the oldest method. It has been used in pharmacy for over 100 years. The tablet is repeatedly dipped in a sugar syrup solution until a thick, smooth, round shell builds up around it. You've seen these. They're the round, glossy tablets that look almost like sweets. Sugar coating is brilliant for masking terrible taste and smell, and some drugs taste absolutely awful. But it has a major downside. The coating is thick and heavy, which significantly increases the size and weight of the tablet. It also takes a long time to manufacture. Film coating is the modern standard. Instead of thick sugar layers, a very thin polymer solution, usually hydroxypropyl methylcellulose, HPMC, is sprayed over the tablet in a rotating drum. The result is a smooth, thin, colored film that barely adds any weight to the tablet. It's faster to produce, more precise, and the tablet keeps its original shape. That blue oval tablet, that pink round tablet, the smooth ones you see in most modern medications, almost certainly film-coated. Film coating can also be made transparent, which is used when the manufacturer wants to show the original tablet underneath while still providing protection. Next is enteric coating. The word enteric refers to the intestines. An enteric coat is specifically designed to resist your stomach acid completely and only dissolve when it reaches your small intestine. How? It's made from a pH-sensitive polymer. Your stomach sits at a brutal pH of 1.5 to 3.5. The enteric coat stays rock solid in that environment. But the moment it hits your small intestine, where the pH rises to 5.5 and above, the polymer dissolves and releases the drug, precisely where absorption is most efficient. Examples include omeprazole, enteric-coated aspirin, and certain diclofenac tablets. These drugs would either damage the stomach or be destroyed by it without that coat. Now let's talk about the advantages of tablet coating. First, gastric protection. Drugs like high-dose aspirin and diclofenac are highly irritating to the stomach lining. Coating prevents direct contact with the mucosa, reducing the risk of ulcers and GI bleeding. Second, drug protection. Some drugs are acid labile, meaning stomach acid destroys them before they can even be absorbed. Enteric coating protects these drugs from degradation, ensuring they arrive at the intestine intact. Third, taste and odor masking. Some APIs, active pharmaceutical ingredients, taste genuinely terrible. Metronidazole is notoriously bitter. Coating seals in that taste completely, making the medication far easier to swallow. Fourth, ease of swallowing. A smooth, film-coated tablet glides down the throat much more easily than a rough, chalky, uncoated tablet. This matters enormously for elderly patients and children. Fifth, controlled or sustained release. Modified release coating allows the drug to be released slowly over several hours, maintaining a steady drug level in the blood. This means fewer doses per day and better patient compliance. Sixth, product identification. Coating allows manufacturers to give each tablet a unique color and shape, reducing the risk of medication errors. But coating isn't all perfect. There are real disadvantages that pharmacists and formulators have to weigh carefully. First, increased cost. Coating adds extra materials, equipment, and manufacturing time. This directly increases the production cost of the drug, which is passed on to the patient. This is one reason why uncoated generics are always cheaper. Second, delayed absorption. Because the drug has to wait for the coat to dissolve before it's released, onset of action is slower compared to an uncoated tablet. For a patient in pain who needs fast relief, this matters. Third, you cannot crush or chew them. Crushing an enteric-coated or modified release tablet destroys the coating and releases the entire dose at once. This can cause toxicity or render the drug completely ineffective. Fourth, manufacturing complexity. Coating requires specialized equipment like coating pans and spray systems, strict quality control, and precise environmental conditions. Any error in the coating process can result in batch failure. Fifth, potential for coat failure. If the coating is damaged through improper storage, humidity, or physical damage, the protection it provides is compromised. Now that we know what coating is, when you see the letters EC, DR, or SR after a drug name, aspirin EC, diclofenac DR, metformin SR, those are coating flags. EC means enteric coated, DR means delayed release, SR means sustained release. These are not optional labels. They tell you exactly how the drug behaves inside the body, whether it can be crushed, and how quickly it will act. So the next time you pick up a tablet and wonder why it looks the way it does, you'll know. That color, that shine, that smooth finish, it's not branding, it's pharmaceutical engineering. If you found this video useful, leave a like and subscribe to PharmaCore Academy. Stay curious, Core Scholars.